The growth in the home care job sector is driven in part by the CDPAP program, which allows individuals who need care to choose their own home care worker. Keep watching to learn what CDPAP is, the benefits it provides, and how to determine if you're eligible. What is CDPAP? CDPAP is an acronym that stands for Consumer-Directed Personal Assisted Program. It's also known as CDPAS, or Consumer-Directed Personal Assisted Services. This state program uses Medicaid to cover the cost of home care. The individual in need of care is known as the consumer, and the person providing care is a personal assistant. Once they go through the proper process, they're authorized and paid to provide help. The program is not only used for elderly care, but also for anyone who struggles to perform necessary daily functions, such as eating and bathing. The condition that needs care must meet CDPAP standards. CDPAP has not replaced traditional healthcare aides or certified nurses and may never be able to, but its popularity is increasing. It's a viable alternative for those who want to provide care themselves or cannot afford other methods. Benefits of CDPAP. Much of the demand for home care aides are being filled by CDPAP-certified aides for several reasons. It's affordable and allows consumers to receive care from the same trusted individual every single day. CDPAP is a more affordable form of senior care. CDPAP also allows the consumer to be cared for by the same trusted individual. This alone provides several benefits, such as improved care and reduced stress, infection risk, and turnover rate. Having a trusted individual providing care reduces the stress consumers may feel. They'll know who's providing them with what services and why. It's easier for them to adjust to and allows them to stay in the home they love. When a caretaker knows their patient, medical issues become easier to spot. This allows the provider to remedy them before they become serious. They can administer medicine or call the hospital in emergency situations. A CDPAP home care provider can provide any form of necessary care. This reduces the number of specialized personnel that need to enter the home and allows for a more complete care, which also reduces the risk of infection. Eligibility. The first step in becoming a CDPAP qualified caregiver is to submit the necessary paperwork. You'll then go through an eligibility check where a certified nurse verifies your ability to provide the right level of care. CDPAP caregivers don't need training or licenses to provide the care their loved ones need. They don't need to be a registered nurse or a medical school graduate, but may need to demonstrate they're able to provide the necessary level of care. Almost anyone can become a CDPAP caregiver for their loved one. The only exceptions are situations where two parties are responsible for one another, such as spouses or parents of children under 21. One of the most crucial eligibility requirements is having Medicaid. Anyone who wants to apply to the program must be insured and eligible for it, as it's the primary payment method used. Other insurances may be accepted. The CDPAP home support worker must be providing services essential to maintaining quality of life. Your request may be denied if they determine you're using CDPAP for convenience and not to maintain health. Almost anyone can become a CDPAP home caretaker, but they must first apply and meet eligibility requirements. If you're looking to find a caretaker to step into a home care worker role, you must first find out if you meet the CDPAP requirements. Check your eligibility here. And if you enjoyed this video, be sure to like, comment, and subscribe.